Myalgic encephalomyelitis can be so overwhelming in so many different ways that it can be very hard to know how to even begin dealing with it. It can so quickly negatively affect almost every aspect of your life. Some ideas for where to start dealing with it include the following. Number 1. Make sure you have been correctly diagnosed. The fact that a person qualifies for a diagnosis of CFS, A, does not mean that the person has myalgic encephalomyelitis, and B, does not mean that the person has any other distinct and specific illness named CFS. A diagnosis of CFS, based on any of the CFS definitions, can only ever be a misdiagnosis. The reason for this is that despite the fact that the new name and definition of CFS were created in response to an outbreak of what was unmistakably ME, this new name and definition did not describe the known signs, symptoms, history, and pathology of ME. It described a disease process which did not and could not exist. Today there are more than 9 CFS definitions, but none of these definitions defines any distinct illness. All they define is a heterogeneous population, a mixed population, of sufferers from various psychiatric and miscellaneous non-psychiatric states and diseases which have little in common but the symptom of fatigue. CFS is an artificial disease category created purely for the benefit of financial vested interest groups, nothing more. It is a meaningless diagnosis. A correct ME diagnosis can only be determined by looking at legitimate descriptions and definitions of the illness, such as the Nightingale definition of ME. A specific series of tests are also necessary to help confirm the diagnosis. Every patient deserves the best possible opportunity for appropriate treatment for their illness and for recovery. This process must begin with a correct diagnosis, if at all possible. No matter what disease you have, a correct diagnosis is half the battle won. Don't accept a CFS diagnosis. It is only ever a misdiagnosis. And don't assume that just because you've been misdiagnosed with CFS and just because you aren't mentally ill that you automatically have ME. This is not the case. There are a vast number of other organic, non-psychological diseases which are very often misdiagnosed as CFS. Number 2. Avoid overexertion. The single biggest factor determining recovery and remission from ME at this stage is appropriate rest and avoidance of overexertion in the early and or severe stages of the disease. It is vital that ME patients avoid overexertion and are never encouraged to exercise or be active or be upright or mentally active longer than their individual limits allow, particularly in the early and acute stages of the disease, but also at any stage. This can only result in unnecessarily relapses, permanent damage, for example to the heart, and disease progression, or even death. Number 3. Work towards learning to accept your illness. Acceptance of the limitations of ME at as early a stage as possible is crucial. Accepting your illness does not mean happily resigning yourself to your fate and to being very ill for the rest of your life, but it is just about acknowledging the reality of your illness, acknowledging that it isn't something that's just going to conveniently disappear if you ignore it for long enough, or if you positive think for long enough. And it's about accepting that there really is no quick fix or miracle cure available, and that ME is something that you will have to deal with and adjust to if you have ME, at least for the moment. Number 4. Educate yourself and those around you about ME and seek appropriate support. Along with coping with the physical effects of the disease, it is also important that you educate yourself about the illness as much as you are able and seek the appropriate physical, financial, and emotional support. You might do things such as the following. A. Educate yourself as much as you can medically and politically about ME, and also educate those around you so that they will know better than to believe the baseless propaganda surrounding ME. B. Find out what financial support is available and what the requirements are to qualify for it if you are severely affected enough to need to do so, as most ME sufferers probably will be, at least initially, and make your application as soon as possible. C. Find out about other services in your area that might be appropriate or that you might need. D. Support yourself emotionally. Stop accepting the blame for getting ill in the first place or the blame for remaining ill. If ignorant friends, family or doctors have been filling your head with this sort of guff, or if they've been trying to, it is just nonsense. Nobody causes themselves to get ME through anything they did, such as overwork, stress, a perfectionist or type A personality, not eating right, or childhood abuse or trauma, or anything else. ME is not a form of burnout, and even with the most positive attitude in the world, you cannot positively think yourself well from ME any more than you can from MS or cancer or Parkinson's. E. Join a ME support group either online or one which meets in person. It helps so much to know that there are so many people who are going through the same thing that you are and that you aren't alone. Number 5. Try to find a knowledgeable doctor. Of course, this is vital and much, much easier said than done. Number 6. Modify your diet and environment. Most ME sufferers, almost all of them, will experience food allergies and or food intolerances as part of the illness, and so will have to avoid certain foods. A rotation diet may also be necessary for some sufferers, where particular foods are eaten only every 4 days. None of these dietary changes will cure ME or will greatly reduce the severity level of the illness, but they may significantly reduce some symptoms and so very much affect quality of life. Chemical sensitivities are also common in ME, as are allergies or sensitivities to various airborne allergens. You may need to modify your environment or to change some of the types of products you buy to minimize your exposure to these things. Air and water filters may also be useful.